Welcome to Sam's Health Corner with Levi Sabathina Obochoma. And today we are going to be talking about breastfeeding. We are going to talk about breastfeeding, especially the benefits of breastfeeding. What is breastfeeding? Breastfeeding is feeding your baby with breast milk, usually directly from your breast. Simple, that's breastfeeding. We strongly recommend exclusive breastfeeding for the first 6 months after the baby is born. That is feeding the baby with only breast milk, no addition of any other thing, no formula, no water, no juice, just breast milk, quality breast milk. And it is recommended to continue breastfeeding your baby through the baby's first to second year of life. How often you feed your baby depends on whether your baby prefers small, frequent meals or longer feedings. So, you should study your baby. So, let's look at signs that indicate that your baby is hungry. The most common way that your baby tells you that he or she is hungry is to cry. Other ways include licking their lips and sticking out their tongue. Another sign is rooting. The baby moves his or her mouth, jaw, and neck to look for your breast. Putting their hand in their mouth, opening their mouth, sucking on things, fuzziness, that is, the baby easily gets upset. These are signs that your baby is hungry. So you need to go and feed your baby. So let's talk about benefits of breastfeeding. Breast milk provides the ideal nutrition for your baby. It has a 99.9 perfect mix of vitamins, protein, fat, and everything your baby needs to grow. And it is all provided in a form more easily digested than infant formula. Have you asked yourself why organ failure is at the increase these days? Because when you introduce your baby to infant formula, water, juice, and other food other than breast milk, do you know what you're doing? You are activating the immature organs to start producing and secreting hormones that will be used to digest those food, and this might lead to organ failure in the future because those organs started work too soon and sudden. That is why sometimes when people are diagnosed of one organ failure or the other, they will be like, I don't smoke, I don't do alcohol, I don't bleach my skin, I don't do this, I don't do that. Sometimes organ failure is traced to the way one was handled when the person was an infant. That's why it irritates me when I hear mothers say things like, which one is exclusive breastfeeding? Was I exclusively breastfed by my mother? Am I not okay? Please, ma'am, that you are okay and you escaped it doesn't mean your baby will. Please, mothers, let's be very careful. So let's talk about immunity. Breast milk contains antibodies that help your baby fight off viruses and bacteria. Exclusively breastfeeding your baby for the first 6 months of your baby's life lowers the risk of your baby having asthma, allergies, ear infections, respiratory illnesses, diarrhea, and fewer hospitalizations and trips to doctor. When it comes to IQ, breastfeeding has been linked to higher IQ scores. No doubt that a child that is exclusively breastfed is always more smart and brilliant. Not just breastfeeding, other activities that happens during breastfeeding like skin to skin touching, eye contact, and things you say to your baby contributes to your baby becoming a better individual in the future. Breastfed infants are more likely to gain the right amount of weight as they grow, rather than becoming overweight children. Breastfeeding plays a role in preventing sudden infant death and lowers the risk of diabetes, obesity, and certain cancers. You might be wondering if your baby is getting enough breast milk, good for nutrition. So check out for these things. Number 1, your baby should not lose more than 7% of birth weight in the first few days after delivery. Your baby feels content for about 1 to 3 hours between feedings. Have at least 6 diapers a day wet with very clear wet pee by the time they are 7 to 10 days old. Someone asked me if size of breast affects feeding. The answer is no. Breast size is irrelevant when it comes to how much milk your breast produce. Small breast might just produce as much milk supply as large breast. People also ask, is exclusive breastfeeding more economical? The answer is no. Exclusive breastfeeding is not more economical because you are expected to feed very well. When I say feed very well, I mean quality, because you are expected to produce quality breast milk that will be able to suit the nutritional value that your baby needs. So you don't feed your baby with milk with no nutritional value. Please, nursing mothers, feed very well. If not for any other reason, for the sake of your baby. Please like, share, subscribe, turn on the notification button to always get my videos firsthand. I love you. See you in my next video. Bye bye.